Hi everyone, welcome back to my channel. If you're new here, my name is Kirtana. I'm a first year nursing student at the University of Toronto's Accelerated Nursing Program. If you're wondering what your first year schedule is going to look like and what courses you'll be taking, then this video is for you. Please continue watching. Before we get started, I'd like you to watch a short disclaimer. So this video is going to be based on my first year schedule, which was in 2022 to 2023. So there might be variations or any differences between that schedule compared to the following year schedule. So bear that in mind. I'm going to leave that website in the description below so you can check that out to see if the new schedule comes out. But for now, the old one is there. A few things to note that might be helpful are if you're new to UofT, the class start time is actually 10 minutes after the hour. So if your class is scheduled to be from 1 p.m. to 3 p.m., you'll actually start at 1:10 so that you'll have enough time to walk to get to classes. Another thing to know is that everyone's going to progress through first year in the exact same way, which means you'll be taking the same courses, so you don't have to worry about course enrollments like you did maybe in your undergrad. And you also will be having the same clinical experiences like older persons, mental health, acute care, labor and delivery, and pediatrics. So everyone's going to get this same 5 rotations, but you might get them in different units and also different placement locations. In semester 1, everyone's going to have the exact same courses and exact same order of clinical rotations. So first is going to be older persons and then it's going to be mental health. And the only thing that will differ is the lab timing. So the lab options last year were Tuesday and Wednesday. It's 2 hours either way, and they were different timings spread throughout the day. So the first course we'll be talking about is the NUR 350, which is actually split into 3 classes. So there's therapeutic skills, there's health assessment, and relational work, which were usually spread out between Monday and Tuesday. So Monday 9 a.m. to 11 a.m. was usually health assessment, which is where you learn how to do different systems assessment on a patient. So like GI assessment, skin assessment, cardiovascular and lung assessments. This is a very dense class in terms of information. You're going to learn a lot more than you need so that you can become a nurse in any clinical setting. So the next course that we had was NUR 351, which is Intro to the Nursing Profession, which is where you learn all the stuff about the history of nursing and how were nurses treated in the past. And also you're going to learn a lot about ethics and ethical situations and how would you respond in these situations. So this was my favorite course personally because you get to see all of the mistreatment and the light that nurses were projected back in history so that you are able to take that information and educate others on what nursing actually is. After the 9 a.m. to 1 p.m. block of classes on Monday, we had a break 1 to 2 where we could have worked on any assignments we had. This is usually when I had lunch, and there are so many options where a nursing building is in terms of food. So you don't have to worry about not having a lunch. They're all pretty close by. And after that, we had class 2 to 4, which was usually relational work, but time to time it switched between therapeutic skills. So relational work is all about that patient-centered care. It's about putting your technical skills aside, technical nursing skills aside, and seeing the patient as an individual person that deserves our care and compassion, not just someone that needs fixing. So in my first year, Tuesdays and Wednesdays were simulation lab days. So the labs on Tuesdays were running from 9 a.m. to 5 p.m. You could get assigned to any 2-hour blocks except 1 to 3. So mine was 9 a.m. to 11 a.m. So after that, I had a 2-hour break from 11 a.m. to 1 p.m. because our next class was therapeutic skills usually, which was from 1 p.m. to 3 p.m. Or it could have been, for other students, it was on Wednesday, any 2-hour blocks between 9 a.m. to 1 p.m. So that's how the labs varied. And in terms of the lab content that we got to practice different things. So majority of the time we got to practice things from health assessment class. So any content we learned that week, we got to practice it. So like listening to heart sounds, lung sounds, checking different vitals, doing different assessments and all that. Sometimes the labs were based on the therapeutic skills content, which is things like learning how to prime IV lines, learning how to give different types of injections, but not to real people. It was just on a spongy object that you would practice different injections. Or we also learned how to do inserting urinary catheters. So everyone's going to get an opportunity to try these things in labs. One thing that I do want to say about simulation labs though is that participate as much as you can in those labs, and also in class make sure you ask your questions and make sure you answer questions, because this is an opportunity for you to learn the most hands-on and fail in a safe way where you're not harming anyone. If you don't know something, just ask the lab instructors to show you. They'll be more than happy to do that. This is a place for you to like try and fail on mannequins. It better be on mannequins than on real people when you go out there in real life as a nurse. On Wednesdays, everyone had one class. It was NUR 361, Introduction to Caring for Persons with Mental Illnesses and Caring for Older Persons. So this is the class that's related to the clinicals you're going to have in semester 1, and this is where you're going to be learning about the complexities involved in caring for those two patient populations, which are older persons and persons with mental health issues. So moving on to clinicals in the first semester, which is probably what a lot of people are curious about. There were 2 rotations. First was older persons. Everyone's going to progress through these 2 rotations, older persons and then mental health. So the content for NUR 361 is going to switch to accommodate the clinicals that you're going to be switching into. So first half, it will be focusing on learning about the complexities involved in caring for older persons. And then you're going to move to the mental health clinicals, and that's when the class is going to switch to you learning about caring for persons with mental illnesses. The schedule for semester 2, if the winter semester, is pretty straightforward, so I'm not going to go too much in depth about that. Everyone's going to have the same 2 courses together. NUR 390 is a community health course, which is where you learn a lot about public health nursing and how to take measures to ensure the health of the population and how can we keep the community safe and healthy. And the other course everyone's going to have together is NUR 325, which is pharmacotherapeutics and pathophysiology. So pharmacotherapeutics is all about using drugs to treat, diagnose, and prevent diseases. And pathophysiology is all about physiological processes that are associated with diseases. The clinicals in semester 2 are going to be different. So everyone's going to get the same clinical experience, but you're going to the order is going to be different for each of you. So there's 3 rotations: acute care, pediatrics, and labor and delivery. And you'll be assigned to go in a specific order. So I had acute care first, and I had class accompanying that clinical placement for first 7 weeks. And then I switched to pediatrics. I had a class accompanying that for the next 7 weeks. And then I switched to labor and delivery rotation, and I had class accompanying that placement so I can learn all of the content. But there's other people that went in a different way. So some had labor and delivery first, and then they went through acute care, and then they went to pediatrics. So that's why it's going to vary, but you all are going to have the exact same rotations, if it is the same as last year. So those 3 clinical rotations are going to span throughout the semester 2 and semester 3. So all of winter semester up until the end of the first year, which is the end of June. The only actual course that everyone has besides the the class related to the clinical placement is the NUR 330, which is Introduction to Research and Scholarship in Nursing, which is where you learn all of the statistics involved in research, which you probably already took before coming into this program. So this is just going to be mostly a refresher, but it's going to be tailored specifically to nursing. I don't know about you guys, but that felt like a lot of information that I put out there. So if you're overwhelmed, don't worry. They will be going over this information again in the orientation session. And you're going to have so many of your peers going through the same program in the same way, at least in first semester. So you have them to rely on. And especially because everyone has the same experiences, they will be the ones reminding you if there's anything new. Like they might just bring it up in conversations, saying, "Oh, hey, how is that assignment going?" And you'll remember that there's an assignment to do. So don't worry about the small details of it. That will come as you progress through the program. The one thing I do want to remind you guys is to be kind to yourself and please be patient while you're learning. Like you're trying the best you can. This is supposed to be very different from your undergrad where you just do tests all the time. That's not how this program is. It's very hands-on. So just be patient with yourself while you're getting through this new learning process, and just take initiative and take opportunities as they come on. Even if you're unsure how to do it, ask for help and make sure you're doing things while you're being supervised so that they can provide you with the feedback that you need. Like I didn't know how to do head-to-toe assessments perfectly the first time around. There's so many times I forgot that one thing in the assessment where I had to go back to the room for, even if it's isolation. I went in, I did that one assessment that I forgot, and then I came back out, and then I just made a note to not repeat the same thing over and over. The last piece of advice I want to give you is to make sure to use all of the resources available to you and ask for accommodations if you need them, or even if you're unsure whether you qualify for these accommodations. Just make sure you ask your professor, and if it's regarding clinical placements, ask the clinical coordinator if you're eligible for any extenuating circumstances consideration. So they'll send out a form called extenuating circumstances before the clinical placements ranking happens, so that they can take that into consideration when placing you at a placement site. So it could play to your advantage if you make use of that. And that's a wrap on this video. Thank you so much for watching. If you have any questions, please feel free to reach out. And if you have suggestions, make sure you leave them in the comments and share this video to anyone that might benefit from it. And I really hope I gave you some insight into what your schedule is going to look like in first year and the courses that you'll be taking. Thanks. Bye till next time.